30% of women will be diagnosed with breast cancer in their lifetime. That's a ratio of about 1 to 10. So 1 in 10 women in their lifetime will have breast cancer. So we can see how important it is. The rate of new cancers in women is 129.1 per 100,000. And out of those 129 women, 19.9 end up dying. This is a global statistics, but it's very similar in Nigeria. The International Agency for Research of Cancer in 2020, which is an organization of the WHO, collated some data from Nigeria, which shows that 30% of all the cancer seen in women is breast cancer. So 1 in 3 women that have cancer in Nigeria will have cancer of the breast. Out of all the breast cancer, only 1% of breast cancer patients are men. It's also important to know. And usually in men, when there's a lump in the breast, it's most likely to be malignant. Another important detail to know is that in Africa, usually women present younger. They have breast cancer at a younger age, 10 to 15 years younger than Caucasian women or women in the West. Where in the West, they get cancer around the age of 50. But here in Nigeria, women start to develop cancer at the ages of as young as 35 years of age. So it's very important to get screened. The exact cause of cancer is unknown, but like I previously mentioned, the postulations are that there's a malfunction at the cellular level that leads to the alteration of a cell, and that alteration causes the cell to grow uncontrollably. One important thing also is to know the risk factors for breast cancer. These risk factors can be, we have some that are modifiable, that is, we can change those factors and reduce the risk of cancer in ourselves, and those that we cannot change, that are unmodifiable. One of those risk factors is a positive family history. So if any of your female relatives, your aunt, your grandma, your sister has breast cancer, there's a higher risk for you to have breast cancer, especially if it's a first-degree relative, that is your mother, your sister, or your daughter. If you have one of such histories, then you're at a higher risk of getting breast cancer. Another risk factor that is not modifiable is a genetic predisposition. Some people are born with some genes. Genes are genetic information found within cells. This is something we cannot control. Some people are just born with it. So if you have those genes, BRCA gene 1 or 2, these are genes that we can test for. If you have those, you are at a higher risk of getting breast cancer. Notably, there's a Hollywood actress, Angelina Jolie. I don't know if you know, she got tested for this gene, and she found out that she tested positive for it and ended up having a prophylactic mastectomy. That is, she removed her breast even before developing breast cancer because she was at a higher risk. Another risk factor is radiation. Because of the world we're living in today, advanced technology, we're exposed to a lot of radiation from our devices, from the earth, from all the human activities that we have. These radiations we're getting from the environment can increase our risk to breast cancer. Or also, sometimes, when we seek medical care, we can be exposed to radiation. For example, when you get a chest x-ray, when you're having a chest infection, you can get a CT done or a chest x-ray done. All those are radioactive activities that can increase your risk for breast cancer. Another unmodifiable risk factor is early menarche. I'll take that together with late menopause. Essentially, female hormones, especially estrogen, supports the growth of breast cancer. So if you start your menses very early, that is less than 12 years of age, or you enter menopause at a later age, you are exposed to estrogen for a longer duration and you're at a higher risk of developing breast cancer. Then if you have had breast cancer before, compared to somebody that has never had breast cancer before, you're at a higher risk of getting breast cancer. So more importantly, the risk factors that we can modify, what are they? Obesity. studies haven't really shown a direct cause and effect relationship between weight and breast cancer, but there's a correlation that we don't fully understand. Those that are obese are at a higher risk of developing breast cancer. So we need to lose weight in order not to have this risk. Then um, an older age at first life birth or never having children. Usually, this is important because when you are pregnant and when you are breastfeeding, the effect of estrogen is less. And that reduces essentially the risk of developing breast cancer. Then, alcohol intake is also a risk factor for breast cancer. This might be because with alcohol intake, there is a conversion of the glucose that is gotten from alcohol to fatty tissue. And fatty tissue produces estrogen. And that essentially will increase your risk of getting breast cancer as well. Then there are some medications as well, birth control pills. There's some hormonal replacement therapy that is given to women on that are menopausal. All these can increase your risk for breast cancer. So what are the symptoms for breast cancer? Early in the early stage of breast cancer, usually there are no symptoms. This is very important, and this is the main reason why we need to get screened. Because initially, you will not know that you have breast cancer because there will be no symptoms until it's very late. The other symptoms are when you feel a new lump in your breast or the underarm. You can have just any thickening or swelling of the part of the breast. You can have a change in the size or shape of one or both of your breasts. There can be a discharge from your nipple. It could be bloody, it could be milky. Your skin can change. There can be a dimple on your skin. You can see a part of your skin being sunken. There can be a rash around your skin or around the nipple. There can be sinking of the nipple as well, where the nipple goes back in instead of standing out. Importantly as well, most breast cancers do not present with breast pain. It can, but most of the time there's no associated pain. So how do we diagnose breast cancer? There are various tests. I won't bore you with that because that's our job. But just to mention a few, the mammogram, breast ultrasound, breast MRI. All these are imaging techniques of identifying the breast cancer. Together with that, a biopsy has to be done. So there's needle aspiration, needle biopsy, and vacuum-assisted mammotome biopsy. Biopsy just means taking a sample of what we suspect is a breast cancer, sending it to the lab for confirmation. And that's the only way of saying 100% that a lesion or a lump that we're seeing is breast cancer. Okay, this is just an anecdote. I'm not here to scare you with this presentation. I just want us to be aware of our bodies and what can affect our body. Okay, so the main part of today's presentation. Why is it important to screen? It's important to screen because if detected early, breast cancer is curable. Well, by the time it has spread to other parts of the body, it is not. All we can do is just make your life better, make the symptoms less. But other than that, it's not curable at that stage. Studies have shown that between the ages of 50 to 69, mortality has been reduced by 16 to 35%. So the main way we screen for breast cancer is a mammogram, which is an x-ray of your breast. But there are some other things that we can do to help the screening process. And most importantly, out of all those ways we can augment breast screening is breast self-examination. This is a self-examination that every woman can do in their home, in the comfort of their home, to check for a lump by themselves. I'll be explaining how we can do that further as we go on. So like I said, a breast self-exam is a checkup that every woman can do at home. The best time to do a breast exam is 3 to 5 days after your period starts. And the reason is because at this time, your breast is not as lumpy and tender, so that you don't get confused and think it's a lump. If you have gone through menopause, you can do your exam on the same day every month. So what do you look out for when you're doing for a breast exam? You look out for a painless lump. There's an image there, you can see there's a swelling just close to the nipple. So if you see anything like that, please kindly seek medical attention. The nipple here, on my image on the left, you can see the nipple where it has gone inside. The image on the right, we can see some bloody discharge from the nipple. We can see dimpling of the skin as well on the image there. Okay, so how do you do this breast exam? First of all, you stand in front of a mirror, either with your hands down, then you put your hands up to look at the breast and the armpits, and then you put your hands by the side. Any asymmetry, any swelling, any change in color is something you should note. Next, you place one of your hands behind your head and then use the other hand to examine the breast. Usually, you use the tips of your fingers and examine each part of your breast either in a clockwise or an anti-clockwise manner, making sure that you're examining each part of your breast. You also have to feel for any lump in your armpits as well. You can also do this lying down. You just do the same. Feel for, with the tips of your fingers, feel for any lump anywhere. Use your nipples to check for any discharge. There's also a very rare condition called inflammatory breast disease. In this condition, you won't feel a lump, but the skin of the breast will change. It will look like the peel of an orange. So we can see that here. If you see that this is a warning sign, you should visit your doctor for further testing. So what are the recent recommendations for screening? According to the American College of Radiology and Society of Breast Imaging, the recommended age for breast screening is 40 years. And in Nigeria, this is what we use as well. So as from the age of 40, every year, every woman should get a mammogram done. In general, we don't recommend for anybody that is less than 40 to get a mammogram done. This is because below the age of 40, mammogram doesn't pick up breast cancer lesions well. However, if you have a family history of breast cancer, screening can start earlier than that age of 40. In fact, it should start 10 years earlier than the age of your affected relative. So if your relative had breast cancer at the age of 35, you need to start screening 10 years before that, so at the age of 25. So what is our own recommendation? Between the ages of 20 to 40, even without complaints, every 3 years, you should get a breast examination done by a certified, licensed healthcare professional. After the age of 40, you should get an annual clinical breast examination and an annual mammogram. But women with an increased risk of breast cancer should do all this, including a breast MRI yearly after the age of 35. So treatment for breast cancer is usually a team effort. It's not just the surgeon or the oncologist. Everybody is involved. And the main treatment is surgery, radiotherapy, chemotherapy, hormone therapy, targeted therapy, and psychological support as well. So when you visit us in the hospital, we'll explain further what all these treatment options are. Psychological support is very important because going through cancer is not easy. You need psychological support and also support from your family as well. We can have complications from the disease and then complications from the treatment. The major complication from the disease is as a result of it spreading to other parts of your body. So it can spread to the lungs, to the bones, to the breast, to the brain, And then it can also block those lymphatic channels, causing swelling of your arms and your legs. Um, the other complications from treatments, like from chemotherapy, you can have tiredness, hair loss, sore mouth. From radiotherapy, you can have irritation, darkening of your skin as well. So how do we prevent breast cancer? There are some steps and measures we can take in our daily lives to prevent breast cancer. So we have to maintain a healthy weight. We have to exercise regularly. We should try as much as possible to reduce our intake of saturated fat. We should not consume alcohol. It is encouraged to breastfeed as well. Then we should get genetic testing when available. We can get
really touched by this. And thank you so much. The national president and the rest of the members. Thank you so much for doing this. I really appreciate you guys. I really appreciate you guys for this. Having said that, on behalf of the national president of Immowa, our APS hosts, and all the members of Immowa, I present this writing machine and a token to Mrs. Bridget in there. I understand the husband was the chief superintendent of immigration who slumped in the office because of his duties. I'm so happy that her colleagues are remembering her that she should not be left alone. This is very thoughtful of you. Madam, it is a day to thank God. It is not all service, it is not all associations that remember this. There is something that, as I used to say, it exposes a family to ridicule. If you have 100 friends, when death struck in, it reduces drastically to 10. And within a very short time, you realize you are on your own. So for an organization like this, an association, remembering you, your colleagues remembering you, that no, they have to give you, no matter how rich, I want you to see more than this. Because it's coming from their life. The mission, the intention of doing this is what matters most. And believe me, this empowerment is more than what you think it is. It goes a long way. In my place, the seven hunger is removed from me. Poverty is over. No matter how little it brings in a day, it will go a long way to solve their problem. Rather than remembering them once in a year and giving them 100,000, believe you me, 100,000 can be fetched in 1 week with this. So thank you on behalf of the recipients. I'm saying thank you to Immowa. Thank you so much. Thank you.
Next person. The next person. The children we are seeing here, their mother was We lost her last month at the cost of childbirth. She's leaving back behind two of her children, a daughter and a son. Our national president is here today to support their father so that he will take care of the children.
It is time to remember her. She was an active member of our association, and we lost her recently at the child heart. Leaving the children behind, we feel we should give them a certain management.
and continue with the empowerment. When they finish the exhibition, they of the people can't do all because of time. But everybody that is here is going to get whatever that belongs to you today. Thank you so much, ma'am.
If I know you, my mother know you. If I know you, my mother know you. She don't get tired, she mother. If I know it, my mother know it. If I don't talk, I'm not going to talk. She don't get tired, sweet mother. I don't go for that desire, sweet mother, sweet mother, sweet mother, sweet mother. Sweet mother, sweet mother, sweet mother, sweet mother. Come and see the Lord is good. Come and see the Lord is good. There is nothing he cannot do. Come and see the Lord is good. Come and see the Lord is good. Come and see the Lord is good. There is nothing he cannot do. Come and see the Lord is good. He gave me victory. He gave me peace of mind. There is nothing he cannot do. Come and see the Lord is good. Come and see the Lord is good.
Ọmọ sí the Lord is good. There is nothing he cannot do. Ọmọ sí the Lord is good. Aka ya, aka ti le fẹ́ mi gbé ma. Olódùn ya, isi iye, ìyá sàṣà. Aka ya, aka ti le fẹ́ mi gbé ma. See what you done for me.
Immowa, I want to negotiate. See how you set with me.
Coming next, record listening. We can call up here now. That phone they on. You don't fall.